Welcome to another edition of the Business and Personal Podcast, and we bring you closer to the people that you do business with. And we're thrilled today to have Dr. Earl Bogrow on. He is the founder and owner of the Dental Center for Sleep Apnea and Snoring, based out of the Detroit market. Met Dr. Bogrow probably 6 or 7 years ago, and have learned so much from him about a very interesting treatment for sleep apnea that affects so many people. Just need to get the word out there, so that's why we're doing this. But first of all, Dr. Bogrow, thanks for finding a little bit of time in your crazy schedule to chat with me today.
Well, welcome. Thank you for having me. This is a topic that's near and dear to my heart from a personal level and from a business level, and how myself getting sleep apnea changed the whole course of my career. So that's kind of my story.
The business and personal podcast, I guess that's perfect because that covers both sides of it. And so yes, the business and personal. So we want people to get a little bit better idea of you. You have been on my podcast before, but maybe for people that haven't heard your story, just quickly explain, what led you to this point.
Well, let me start by just saying, the whole topic of sleep apnea, I got involved with it because I'd say a good 15 years ago, my wife started noticing that I was snoring more. She would say, not only was I snoring, all of a sudden, she said, sometimes I either stop breathing, I make these little noises. All of a sudden, I'm getting up 3, 4, 5 times a night thinking, hey, I'm getting older, I gotta pee more. I'd also be coming home from work more fatigued. And finally, reluctantly, I mentioned this to my doctor at a physical. He said, let's give you a sleep test. At that time, I used to think that the only people that got sleep apnea, and all sleep apnea, it's called obstructive sleep apnea, meaning there's a blockage in your airway when you sleep. I thought the only people that got that, the prototype was fat old men, 300-pound people with a 20-inch neck. I'm weigh 175. I work out religiously. I'm very active. But I went and had the sleep test, and sure enough, I had mild to moderate sleep apnea. I started to read about the correlation of sleep apnea and heart problems, sleep apnea and strokes, correlation of sleep apnea and diabetes, sleep apnea and dementia, because over a period of time when you have sleep apnea, you have a decreased oxygen level of the blood, which can lead to a decreased oxygen level to your brain. So it can lead to so many things. When I started to read about that, and luckily at that time I didn't have many other health issues, I said, what do I do? And back 15, 20 years ago, everybody got a CPAP unit. I think most of your viewers probably know what a CPAP is. It's a machine that blows air in your throat, that opens up your airway. Again, all sleep apnea is a blockage of your airway when you sleep. Where it generally takes place is in the back of your throat, right at the junction of the back of your tongue and your throat and your neck muscles. While you're awake, most people, I don't know anybody who snores while they're awake. But the minute you go to sleep, what tends to happen, some people just anatomically, genetically have a smaller airway. I know I do, and most of my patients do. But what happens as you fall asleep, the lower jaw drops back, the tongue drops back, the neck muscles kind of relax. And all of a sudden, the space that's wide open during the day gets smaller and smaller until one of two things could happen. Either we're going to start to snore as the tissues vibrate against each other, or the next thing, which is the more serious part, it actually collapses. When I give a lecture, I usually start by saying, you can go weeks without eating, you can go days without drinking, but you can't even go a minute without breathing. You have to breathe. And when our bodies recognize, our brain senses that we stop breathing for even a very short time, there's a release in our body of a little adrenaline and cortisol. And that's what people get, this little gasp or little cough. It's almost like your brain saying, hey, start to breathe or you're going to die. It's a good thing, but then it throws all of the stages of your sleep out of whack. You don't get deep sleep and you don't get REM sleep. And then all of a sudden, the symptoms that you start to get, anywhere from snoring to daytime fatigue to waking up many times during the night, to blood pressure problems, to obesity, they're all related to getting as a result of sleep apnea. And it can lead to all these other medical problems that I just led to. So that got me involved. So I got a CPAP. That's 15 years ago. They said, I said, what do I do? I got it. It helped me. I know it helped me, but I didn't like it. If you talk to anybody who has a machine, and statistically, about 50% of the people who get a CPAP don't like, either won't use it or can't use it. And so I started reading my dental journals, the use of these dental appliances in lieu of the CPAP. I joined the Academy of Dental Sleep Medicine. I had an appliance made for myself. I went from having multiple wake-ups during the night to none. I went from snoring to no snoring. I went to having fatigue during the day to no fatigue. It was so miraculous for me personally that I jumped in with both feet, studied it extensively, joined the Academy of Sleep Medicine, incorporated it in my practice till the point came where I had another dentist take over my general dental office. I practiced general dentistry, Ryan, for over 30 some years. Love dentistry. But this was a calling for me. It worked so well for me that I started to incorporate and to help people. And then it became the point where I built a brand new office in the last 2 years that I now am able to treat more people. I'm one of only a few dentists who are certified diplomates of the American Board of Dental Sleep Medicine. Legally, any dentist can help with this, but you want to find somebody who is very qualified. So I guess the next thing that you would want to say, well, how is dentistry related to sleep apnea? So if you want, I can keep talking.
Hey, you're on a roll, man. I don't want to stop you. Keep on going.
So what happens when you have sleep apnea, there's three things that you can do to treat it. Well, first of all, again, as I pointed out, it's a condition that closes our airway in the back of the throat. So you go to sleep, you start having that. And if you remember nothing else, I want you to remember these next three numbers, the numbers 40, 70, and 80. And what that means is 40% of the adult population snore. That means in the United States, over 90 some million people have snore. Of the people who snore, 70% of those people statistically have some form of sleep apnea. Of the people who have sleep apnea, approximately 80% of those people are undiagnosed, meaning there's millions of people walking around with these signs and symptoms and don't do anything about it. It's very easy to rationalize not doing anything, especially in early signs of sleep apnea. People say, well, yeah, I snore, my father snored, my grandmother snored. Yeah, I wake up during the night more than I'm getting a little older. I can't sleep as well. Yeah, I'm more fatigued. But they don't realize that it really is affecting their lives, everything about their lives. Having that alertness, not having that daytime fatigue, it's really tough to do but people accept it until they find out there is a better way. And that's my mission, is to help people to find that way. And I never try to talk anybody out of a CPAP. Once you have sleep apnea, you have 4 choices what to do about it. 1 is do nothing, but it's not going to help you. It's only going to hurt you. 2 is the traditional way, is a CPAP, a machine that blows air down your throat. It works if you can tolerate it. The third choice, which I don't think we really even need to go into today, there are different surgical corrections, including probably the newest one on the market, which is called Inspire, which is one where they put this pacemaker under your skin and it's surgically implanted into your body. And then the fourth solution is what I do, is what I treat patients, and that's by making a custom dental mouthpiece that guides your jaw slightly forward. It's the same concept, Ryan. Let's say somebody's unconscious and they're administering CPR to resuscitate them. What's the first thing they do in CPR? If somebody's unconscious, they pull the chin out and the jaw forward. Why? Because it opens the airway. It's all about maintaining an open airway. When your airway's open, you can't snore. Your airway doesn't shut down. You don't have sleep apnea. So we can make a custom dental mouthpiece that will guide your jaw to the position that will keep your airway from closing. Now, it's a simple concept, but it's not that simple either. It's not that simple for the fact there are currently well over 100 appliances that are approved by the FDA for snoring or sleep apnea. I'd be the first to tell you a very high percentage of the appliances on the market today, whether it's online, over the counter, even some that some dentists make, it could work, but if it's not set right, if it's not adjusted right, it could cause jaw problems, cause your teeth to shift, cause your bite to change. So the last thing you want to do is solve one problem and create a new problem for somebody. So the biggest change in the development of these products, and the ones that I make and I learn about, are ones that are custom made and adjustable, meaning we don't just thrust the patient, we guide it little by little. That whole adjustability factor changed the whole ball game, as well as now the data now shows that in most cases, the dental appliance approach is just as effective in treating the apnea as a CPAP.
So, how, for the people that are listening and they've heard you talking about all this, like, yep, my wife's nudging me every time in the middle of the night because my snoring. So based on what he's saying, maybe I'm a candidate, I should get checked out. So someone in that, and there are so many people that, hey, I know I snore, I might have sleep apnea. They don't bother doing anything with it because they think the CPAP is the only solution. But,
and they think snoring is normal. And I'll tell you, snoring is like the tip of the iceberg that kind of tips you off that something. And usually sleep apnea does get worse with age for two reasons. One, most people as they age gain weight. Weight gain is probably the biggest contributing factor, not the only one. I have many patients skinny as a beanpole who have sleep apnea. The one thing we cannot control as we age is our muscle tone, our tissue tone. Everything just relaxes, sags a little more. During the day, we're fine. Our jaw's forward, our tongue's forward, our neck muscles are out. But the minute we go to sleep, everything relaxes, our jaw settles back. If somebody already has a small airway, it's going to become more prominent and it's going to start to surface. And that's why it gets worse with age. So it's not going to, typically it does not go away. Weight loss can help, but it's not. I have many patients, it doesn't matter how much weight I lose. I know I'm always going to have this, but it's a simple solution. I just wear this dental appliance, which I can give you, show you or talk to you about, and that's the bottom line. So there are over, like I say, I've narrowed it down to about 2 or 3 appliances that are really, really effective and do not cause any of those side effects that we talked about.
So for our viewers that are interested, do you have some samples there that you could show quick for our YouTube viewers?
Well, this is one of the newer, and I will tell you the technology involved in these appliances is dramatically improved even in the last 5 years, where before these were very big and bulky pieces that look like putting a hockey puck in your mouth. Now they're almost like orthodontic appliances. They're almost like retainers. They're this small. They in the unique property, they have these little projections on the side, hard to see on the screen, but that kind of keeps your jaw. So when this is in your mouth, you can still open and close, you can still talk. It just keeps your lower jaw slightly forward so your airway doesn't collapse. But this is, like I said, the appliances now, I have very few patients who can't get used to these very easily. Again, it's almost like a little bleaching tray to that point. So it's not a difficult thing to get used to. It's very comfortable. And the good news is this is a dental solution to a medical problem. This is covered by medical insurance, not dental insurance. The research now shows that this is just as effective. So now most insurance plans now have benefits for dental appliance therapy for sleep apnea. So that is a big thing to allow more people to get the coverage. And what I do different than most dentists is I've got myself in network with medical insurance. So the out-of-pocket cost to most of our patients gets reduced drastically because of that.
And for people that wear retainers, so that would just replace the retainers that they wear at night?
A lot of people wear retainers or bite splints because they clench or grind their teeth. This acts as a dual appliance. It does both. It acts as a retainer and it acts to guide the jaw forward. And there are many steps we make to make sure that it's stable. We make sure that there's no other changes in your teeth. There's a lot of misinformation that these appliances cause jaw problems or cause your teeth to shift or cause your bite to change. If made right, if adjusted right, that should not happen. And we don't just give this to patients. We do measurements. Everything is digital now. We take digital impressions, so it's simple. We wave a wand over their teeth. We get exact replicas of their teeth. And the appliances are, if anything, sometimes it actually helps jaw problems. It maintains the teeth position. It does just the opposite of what it's accused of causing problems of. So those are other good signs.
Well, I just love getting this message out, Dr. Bogrow, because it literally does save lives. I mean, there's people that...
Can I interrupt one other thing? I really think this is important. We talk about sleep apnea, but when I give talks, most people talk about health. They talk about diet. They talk about exercise. But that last component of really good health is sleep. And unless you're getting proper sleep deprivation is, we're at national epidemic levels of people not getting enough sleep. It used to be a badge of honor. Oh, I only need 2-3 hours of sleep. Nobody just needs 2-3 hours of sleep. We need 7-8 hours of sleep. And again, so I want to read you a little thing. We talk about sleep, we talk about health. So this is from a great book called Why We Sleep. It's a great resource about sleep. But listen to this. Scientists have discovered a revolutionary new treatment that makes you live longer. It enhances your memory. It makes you more creative. It makes you look more attractive. It keeps you slim and lowers your food cravings. It protects you from cancer and dementia. It wards off colds and the flu. It lowers your risk of heart attacks, strokes, not to mention diabetes. You'll even feel happier, less depressed, and less anxious. Are you interested? Sleep. That's what sleep is all about. Think about getting a good night's sleep. And when people have long-term sleep apnea, they never get that. They never wake up refreshed. What I hear many patients say, you know what? I wake up, I don't feel any more refreshed when I wake up than when I went to sleep the night before. So, and again, there's all these studies, on getting the benefit of proper deep sleep, REM sleep, which are stages of sleep and I give a whole talk just on that, but it's just, unless you get it, there's quantity of sleep and there's quality of sleep. We need both. And I could help, whether you get the CPAP, whether you have the surgery, the dental appliance, that helps with the quality of sleep, but you still need the quantity. And the magic number for most people is at least 7 hours.
Sometimes we overthink things and overanalyze things, and the simplest things still work today, right?
And so if there's any other, there's some other related topics that this whole field of sleep apnea has kind of activated. One of which is most people you can either breathe out of your nose or your mouth. Many people are complaining or have problems with dry mouth or mouth breathing. Nobody should be a mouth breather. There are all these new studies to show the benefit of nasal breathing over mouth breathing. So anything we do that's going to keep your mouth closed is going to stimulate your nasal sinuses, which are so much healthier for your body. It's a natural vasodilator of your body. When you're breathing through your nose, our nose filters the air, it warms the air. So part of our treatment is teaching people how to breathe more effectively through their nose as well. So again, there's so much new information out there on sleep, on breathing. So we're just entering a whole new era on being able to stay healthier.
So Dr. Bogrow, anybody that's still listening certainly is interested in getting help from you. What's the best way for them to reach out?
My office is located in Southfield, on Northwestern Highway near 12 Mile in Southfield. Our office phone number is 248-827-1144. Myself and I have another doctor, Dr. Jason Sherbel, who practices with me, and our whole practice is dedicated entirely to dental sleep medicine and making oral appliances for people who snore or have sleep apnea.
I love it. What an awesome mission. Thanks so much for coming on again and kind of giving people an update and sharing your message.
And I do want to bring up one other thing. We talked about CPAP, which is most people are familiar with, that they know people have it. It used to be that you needed to try a CPAP before you could get the oral appliance. Medical insurance now, at least for people with mild to moderate apnea, go directly to the dental appliances. So again, this is the newest systems are now show the effectiveness of the dental approach. I work with several sleep physicians that many patients can't tolerate their CPAP. So it's a great alternative from a traveling standpoint. Much easier to walk around with a little bite splint in your mouth than it is to walk around with a suitcase with a breathing machine. So
no doubt about that.
I just want to emphasize that point. So any other questions that you want me to talk about?
No, I think you covered it perfectly well. So not a lot more to add. I think you made it pretty easy to understand how this is treated, and hopefully.
And like I say, what I used to say, I did general dentistry for 30-some years. Loved that, and I also teach part-time at University of Michigan Dental School. They have a program designed to help dentists learn more about this. So the dean of the school asked me to come aboard 8 years ago, and now I'm actively helping, working, teaching. But I used to say I love helping people save their teeth. Now I save the relationships in their lives. So it's incredibly gratifying from my side how many people, it's life-changing. And knowing when you're getting that good sleep, how it affects your body and your lifestyle. So that's just something I want to emphasize.
Absolutely. Thanks again for coming on and sharing your awesome message.